everyone, and welcome to the Talk with the Doc with Dr. Akil Taher. I'm Velan Hawkins, and I'm so excited to bring this fireside kind of chat to a topic that we all probably been hearing the buzz around, called Lp(a). You got any questions? What is it? How does it work? How do we know we have it? All of this comes into play, and all of which I've got my little questions here for Dr. Akil. We've actually had some questions from an audience that we had, and we'll be asking those as well. But right now, let me just tell you a little bit about Dr. Akil. He is such a generous man. He is a resurgent physician, practicing family physician. He is a septuagenarian athlete, an author, a speaker, and if you have a group or are part of a group and you'd like Dr. Akil to speak to your group about this topic or any other topic that might be of concern for your audience, let us know. But today we're talking about Lp(a). And that is a little thing that is really a very big thing, and we're going to find out why. Dr. Akil, thank you so much for doing what you do. It is such an honor to be here, asking you these questions and being a part of your circle of influence and change for the better.
Thank you, Lynn. Thank you for having me, and thank you for that generous introduction.
All right. First question is, again, we've heard of it, but what is it exactly? Lipoprotein A. How's it different from any LDL cholesterol?
To start off with, Lp(a) or Lpa. This is one of the things in which when we do lipid profile, doctors don't ask for it. And patients have to remember LDL, bad cholesterol, HDL, good cholesterol, VLDL, and triglycerides. So this is one more thing to remember. So what I thought was, let's remember this by let's please ask. So Lpa. Let's please ask the doctors and also people around you if they have got their Lpa done, if they have the risk factors. Lynn, you asked me about what Lpa or Lp(a) is. It's a fatty particle in cholesterol. It's like your bad cholesterol. It has both the apolipoprotein B in both Lpa as well as in LDL, your bad cholesterol. But what Lp(a) has, it is an apolipoprotein A. This makes it more atherogenic. So more inflammation, more clots, more plaques build up, and therefore more cardiovascular disease like heart attacks or strokes, even peripheral artery disease. Now, this can happen at times even without the LDL being high, or it can happen with the LDL or the bad cholesterol being high. But it causes premature heart disease and other cardiovascular disease.
Is that why it's called a silent risk factor?
You know, Lynn, it's a silent risk factor because for a long period of time we knew very little and nobody ever tested it. So even in my case, my Lp(a) is high, but I was tested just about a year back when I had to ask my own cardiologist. So people who have this are not aware of it, and they may be having a very healthy lifestyle. One fine day they get a heart attack and they find out that they have a Lpa high. So that's why it is a hidden factor. And people should be aware of the fact that to get it tested, and we probably talk about it if you have the questions.
Yes, because actually my next question, who should get tested?
You see, in my opinion, anybody who has a family history of heart disease, strokes, peripheral disease, aortic stenosis at a young age should be tested, number one. Number two is if you have yourself a prior history of a cardiovascular disease at a young age for, say, 55 and younger in men and 65 and younger in women, they should get tested. Number three is what we call as familial hypercholesterolemia. That means your cholesterol is so high that they do not respond to treatment. Then you have certain sect of people like South Asians and Black Americans of African descent. They have a very high LPA, so they should get tested. Now, overall, the general consensus in the world is that everybody should be getting tested their LPA little a at least once. But sad to say that only in 2018 or 19, that we really started testing for LP little a, and that to very few people. And in, say for example, from 2012 to 2019, only 0.3% of the people were tested in America for LPA.
3% of the population.
0.3%.
0.3% of the population. And we know that there are people, young people, old people, that you wouldn't think would be, leaving us for a heart attack or in fact even having a stroke. And yet, the diagnosis is undetermined as to cause of death beyond the heart attack. And what I'm hearing you say is that this could potentially be one of the underlying risk factors.
Correct. So many times you find young athletes who are in great shape physically and they die. Sudden death, cardiac arrest. We don't really know whether LPA was responsible for the deaths, but it could be. Mm-hmm. Mm-hmm. And there is so much new research being done about LPA, and it's a hot topic. So we don't really know if these people, young people, died because of this particular LPA being high.
Mm-hmm. So how is it measured? I understand that there's two forms of measurement, but which unit of the two forms is better than the other? How is this measured?
See, it is measured by milligrams per deciliter, which actually checks for the mass of the LPA. And then you have what is called as it is nanomole per liter.
Nanomole per liter, okay.
So nanomole per liter actually checks the particle size and how many particles. So it is a better way to go with a nanomole per liter. So if you're going to your doctor, please ask that I would rather have my nanomole per liter done rather than my milligram per deciliter. Now, nanomole per liter, the normal is 75 or less, and abnormal is 125. Now, in between, we are not sure. So that we are not sure between 75 and 125. In milligrams per deciliter, you're below 30 is normal, and above 50 is abnormal. Again, between 30 and 50 is a gray zone.
Gray zone meaning it could potentially be part of the higher level results happening or the lower level results.
Correct.
We just don't know yet.
Correct.
Okay.
Absolutely.
Okay.
Research would be able to tell us that.
So, Dr. Akil, if my LP little a is high, should I get retested over time? You said get the test once, but then should I get retested?
It comes down genetically from your parents. That means you do not need to get it tested more than once. Having said that, there are certain conditions in which you may want to test it again. For example, if your cholesterol is very high and your doctor puts you on the PCSK9 inhibitors, that is your Repatha. And if you are put on Repatha, it brings down not only your cholesterol, but it brings down your Lp(a) by 25 to 30%. So in that case, if somebody is started on this injectable Repatha, it is good to get at least one more reading to see if the Repatha is working on the Lp(a), even though Repatha is not for treating Lp(a). It is not approved by FDA. It is for high cholesterol. Number two, there are certain studies done that whole food plant-based diet, no salt, oil or sugar diet, along with that, can reduce it by 16%, the Lpa. So in that case, if somebody is going on a plant-based diet, then once afterwards can do it in about 3 or 6 months to see if the Lp(a) has come down. And finally, for menopausal women, because during menopause, the Lpa goes higher up. So women should get it tested one more time during menopause to see if the Lpa has gone higher. These are the three conditions apart. Otherwise, you don't need to test it again.
Okay. And you're retesting to see if it went higher or lower.
Correct.
Okay.
Correct.
Okay. You said it was hereditary, but many of us, this is a fairly new testing that's been introduced. So we don't know if our parents actually have this gene or this piece of the DNA. What's your recommendation there?
Your recommendations for testing, or for your recommendation in what to do if you have Lp(a)?
Yeah, if you're tested, because you don't know if your parent has it. You get tested, you find out that you have it. Should you then, if your parents are still alive, have your parents tested for it?
Everybody in your immediate circle should be tested. Your siblings, your brothers, sisters, your children, your nephews, everybody should be tested.
Okay.
Number one. And number two is that once you are having this, then you should be careful about, even in children, you may have to get it tested, even if they are not old enough to actually get the manifestations of cardiovascular disease, like heart attacks.
Does having Lp(a) guarantee that I'll have a heart attack or a stroke?
No, it does not guarantee, but it is a risk factor. One of the risk factors. You have other risk factors too, like smoking, high blood pressure, abusing drugs, alcohol, not exercising, eating badly. All these risk factors are there. But if you have Lp(a) high, then you should concentrate more on the other risk factors, because now you have double this thing. Lpa is high, plus if your other risk factors are not under control, then you have a greater chance of getting a cardiovascular disease like heart attack or strokes.
Let's talk treatment options. Can statins, or you talked about some lifestyle changes, can statins or lifestyle changes really lower Lp(a)?
Let me put it this way. Statins may be helpful in getting the cholesterol lower, but statins do not lower the Lp(a). In fact, statins increases the Lpa. So in my opinion, statins have no effect on Lpa. Now comes your lifestyle. Your lifestyle in terms of a healthy diet, exercise, restorative sleep, managing your stress, managing your high blood pressure, all this have no effect on LP little a. But having said that, remember what I told you. A whole food plant-based diet in terms of a lifestyle change can help lowering your LPA. But other than that, it has no other factors do not have an effect on LPA.
So are there any new therapies being developed to lower LPA, and if so, what are they?
There are quite a few drugs in the pipeline. Certain companies like Amgen, Novartis, you have Eli Lilly, they are coming up with some great drugs which they're injectable, but they can lower the LPA from 90 to 98%.
Wow.
But they're injectable. And there is one oral drug, I don't know if I'm pronouncing it properly, but Malbolin. This is an oral pill, but it has a lot of side effects like headache, your backache, and fatigue. So these are the options there, and they should be coming quite soon.
Okay. And quite soon means this year, next year, what should we be kind of expecting there?
You see, all these drugs are in the phase 3 trial right now. That means they're looking at not only lowering the LP little a, but also trying to figure out that does it reduce heart disease. So that is what once they find out that they're reducing the heart disease, then it should be here in 2026 or by latest 2027.
Okay, good to know, good to know. If someone has a high level LP(a), how can they reduce their heart disease risk now? What can they do now to reduce their heart disease risk?
I think we touched on this. What I would say is that if you have LP(a) high, be more watchful of your other risk factors. If you're not on a plant-based diet, get on a plant-based diet or cut down on your meat, eggs, and dairy. That should help. If your cholesterol is high and it's not going down, get Repatha, stop your smoking, get your blood pressure under control, exercise every day. These are things overall that can help you not getting a cardiovascular disease. But like I said, if you have LPA along with it, and LPA is the evil cousin of your bad cholesterol. So remember that once you have that, you've got to be extra careful about your other risk factors.
So you mentioned PCSK9 inhibitors that help with LP(a), help reducing it. What do they actually do?
Yeah, you see, what they do is they lower your cholesterol, but we do not know why it does lower your LPA. But in my case, for example, my LPA was very, very high. But after being put on Repatha, my LPA has come down. It is still high, no doubt, but it has come down from being very high to high.
Okay. So they are inhibiting something and working. So does LP(a) affect conditions beyond heart attacks and strokes?
Yes, there's one thing I touched upon, I believe, was aortic stenosis. That's the aortic valve. Now, what does this aortic valve does is the oxygenated blood from the heart is pushed through this valve into the aorta to the different parts and organs of the body. Now, because of calcification due to LPA, this valve is defective now. So the heart has to do more work to push the blood in through the valve. And so you can get heart failure. And number two, if this valve is very defective, you may have to do surgical replacement of the valve. So anybody, especially older people, if they have got an LPA high, they should be watched for aortic stenosis.
Okay. So why haven't most people heard about Lp(a) until recently?
The same thing, because very little was understood. I had my I had my first heart disease at the age of 56. Nobody knew about LPA. So first of all, not knowing about LPA and not knowing still whether it will have an effect by lowering it, it will have an effect on reducing heart disease. People don't pay too much attention to it. But now I believe in Europe it is being done for everybody, once at least. And we in America should be doing it on everybody at least once.
Yeah, I was just going to ask you, should we as patients really lobby our doctors to have this as a standard inclusion in our cholesterol panels?
At least for once. The idea is that I think most of the insurance pays for it, and even if they do not pay for it, I believe that it can be done free, and in some cases they're actually paying you for getting this test done now.
They are. Mm-hmm.
And I believe you, Lynn, told me once that they're paying the people now. And I think people should be aware of it. They should go online, figure out what this is, and get it done.
And we will definitely be sharing the link to your having the ability to schedule your appointment to get the blood test for free. And as a matter of fact, it's part of an ongoing national study. So it doesn't matter where you are in the US, you can get this test for free, and they are subsidized, so they will even compensate you for getting the test. We'll put the link in the video and the link in the show notes so that you can have that. But I'm going to give it to you right here. It's bit.ly/VLH-care-access-LPA. And again, you should see that in the going across the bottom of the video, as well as in the notes that are attached to this video, because I really appreciate the fact that now that we know that this is something that can help people to better understand their own health, but our medical professionals can understand more as to why our cholesterol numbers aren't moving, and be able to take the right intervening precautions.
Correct.
To help us to get our cholesterol lowered. And I know I have a friend who just works out all the time. I've got to get this weight off, I've got to get my cholesterol and high blood pressure under control, and this may be a factor that hasn't been looked at that could be a reason that this is such a struggle for some people. So thank you for that. Now I want to ask you really quickly, you touched on it a little bit, but is LP(a) a concern in children?
See, because it is genetically comes down through from your parents, obviously children are going to have it because it is there when you are born. Now, in children, pediatricians generally do a lipid profile between the ages of 9 to 11. But regarding the LP(a), I think that people should do it. Doctors should ask for a test at the age of 5. Now, I know I've been asked before that what are the numbers that we are looking for. I'm not sure whether the pediatric high levels are the same as for adults.
Mm-hmm.
And what do we do after we come to know is something that I do not know. Of course, the moment you have that positive, then you should, even in children, you should be even more careful about the other risk factors. That child should be eating a proper diet, exercising, sleeping well, and all those other 6 pillars of lifestyle medicine, knowing that you have an LPA at a very young age.
Okay, parents, are you hearing that? So here's a good question. Is there a role that aspirin can play for people with Lp(a)?
Some few researches have been done that aspirin may be able to reduce the risk factors of people who have LPA in getting a heart disease. But these are very preliminary studies, so we don't know much about it. But baby aspirin may have that effect.
Can high Lp(a) raise heart attack risk factors even in healthy people?
Absolutely. We discussed this about athletes. And I have one person, I just read this a few days back. What it says is, committed to avoiding the heart disease that ran in her family, Sandra adopted a healthy lifestyle and prioritized annual preventative screenings. Despite maintaining normal cholesterol numbers, plaque built up on the walls of her arteries. At the age 39, she almost died of a heart attack caused by a 95% blockage. Now, further testing showed the likely problem. She had high numbers of lipoprotein A or Lp(a). So that you can have absolutely no high cholesterol, you may be having a healthy lifestyle, but this hidden risk factor, if you're not aware, can bring you down. And with that, let me give you another case study.
I was just going to ask you if you had any case studies.
And this is a gentleman who in his 50s, mid-50s, happened to get blockages of his coronary arteries. Of course, he was having an unhealthy diet, did not exercise, had a type A personality, bad genetic history where sister and mother, a brother died at young age. And so, having said that, he got his stents placed. They were non-medicated, got the bypass done in his early 60s, and then apparently his cholesterol would not come down. No matter, it wasn't statins, very high doses, but it would not come down. Then the doctors put him on Repatha, and his cholesterol, his LPA came down, and he's following a whole food plant-based diet right now. So this is a case study of a person who is almost transforming by having a proper diet, because that's the only thing you can do right now. And follow the other risk factors, try to reduce the risk factors about exercising and sleeping well and all. And this patient apparently is myself.
Wow.
And so at the age, I'm 77 now, I do have a high Lp(a). I have a Wolff-Parkinson-White syndrome, that's a conduction defect in the heart, an accessory pathway. I've had stents, I've had bypass, and now I've got the Lp(a). But I'm doing good. And for me, the important thing before the drugs come into in 2025, 2026, please follow the guidelines and try to, as I said, nutrition is the most important pillar out of all the other pillars of lifestyle medicine. And I believe very strongly that if you can be a whole food, plant-based diet, we have shown it reduces your LP(a) by 16%. So try to do that and follow the other lifestyle pillars.
Well, that is amazing. That is a tremendous drop too. If you're looking at the threshold of your test was the lower level 50 to, you said what were your numbers
Yeah,
there?
the numbers were below 30 is normal. Over 50 is abnormal. Mine was 315.
Wow.
So the last I did it came down to about 160.
Oh my goodness.
So I think that the plant-based diet is helping me. So is the Repatha. So let's hope when the new drugs come in and what they have, we go from there. In the meantime, I would like once more ask everybody to ask other people if they've got their LPA done at least once. And when you go to your doctor's office, let's please ask.
I love
LPA.
that. Let's please ask. But one of the questions that came in from our audience is an ask question, because he had his LP(a) measured. He got the results. He took them to his doctor, and his doctor was not sure how to interpret the findings. How does somebody work with that? If your doctor doesn't even know how to interpret the results, where do you go?
That is why this talk is extremely important, because I've talked to you about what to do, which tests to do, what are the normal numbers, what are the abnormal numbers. Take this. By now, people who are hearing this or have heard this should be able to know more than some of the doctors in regards to LPA. So take this and talk to your doctor, and even if it does not know, and I don't blame doctors, they've got so many other things, you can always say that, look, I'm aware of the fact and I believe my numbers are very high. Do you think anything can be done? And if you're going next year in 2026, you can even ask your doctor, the new drugs come in, and what are my chances of having this since my levels are so high? But never forget, in terms of overall risk factors, you have to be doing your own regarding the diet, the exercise, lowering of blood pressure and all that. That is so important.
It really is. And we had some questions come in about that. I go for my routine checkups, and they do the cholesterol checks and this and that, but will this particular test be covered by insurance? And what if I'm one who maybe doesn't have high cholesterol and I'm asking for this test? Will this test be covered, do you know?
Yeah, all the more important is that if you have somebody in the family, or if you have had some heart disease or peripheral arterial disease, then whether your cholesterol is high or not, you should get it done, LPA. But in my opinion now, at least once in your lifetime, your test should be done. If your test is normal, that's it. There's nothing else to be done. But if your test is not normal, then we are looking at other avenues for where to go in.
And the only way to really know is to test the system, right? Ask for it and find out. Let the insurance company tell you
Correct.
if it's going to be covered or not. Here's a great question from one of the audience members. Is there anything helpful about having Lp(a)?
Very nice question, very interesting question though. From what I know, that initially it was because having a low LPA could help in bleeding disorders, especially during deliveries and when you had that factor which caused a lot of bleeding. This could prevent that. But I'm not too sure about this. But it's an interesting question when people have low. I've not seen very many people have a very low LPA in my practice, but normal, if anything is below 50 is considered normal milligrams per deciliter, or nanomole per liter if it is less than 75. It's normal.
Okay. This question is about the PCSK9 drugs again. Does insurance cover them? And will it cover, well, I guess, this question says if you don't have high cholesterol, since it's not yet elevated LPA.
Your PCSK9 drugs are not covered if you do not have high cholesterol. And they're only covered, if you have high cholesterol, they're only covered after your other drugs like statins are not helpful. So that is if you have high cholesterol. Now, if you do not have a high cholesterol, your PCSK9 drugs are not covered by insurance, and FDA does not approve for the treating of Lp(a).
Okay, well that's pretty clear. So you talked about this, but a question came in, and I'd really like to have you reiterate. What are the guidelines that you feel should be in place regarding checking Lp(a) in children?
Like I said, that everybody, any child who has his parents or his siblings or his cousins or his uncles having a high LPA, they should be tested at the age of 5. Now, having tested at the age of 5, and if it is high, then let your pediatricians decide what is the next step. Mm-hmm. But you should get, I have a grandson who is 12, but I came to know only last year. So, and I am high, very high. My daughter is high, not that high, but high. And so we have to get my grandson checked and get it done. Mm-hmm. At least know what it is. Mm-hmm. Mm-hmm. So that we can take care of other risk factors, mm-hmm. even more stringent about it.
Mm-hmm. Wow. Well, this has been great. And one of our audience members commented, it just sounds like the best course of action is a whole food, plant-based diet and lifestyle. And so thank you, Dr. Akil, for bringing this important information to the forefront for our audience, and all that you do on every topic that you broach in your monthly Talk with the Doc sessions. And this video will be on YouTube and every place else. We ask that you share it widely so that others can learn about this Lp(a) cholesterol risk factor. And is there anything else that you'd like to say as we're wrapping things up?
Not really. I totally agree with the last person who asked a question regarding the whole food plant-based diet. I've been that for almost now 15 to 20 years, and it has helped me immensely. So my energy levels are high, and I attribute it to my lifestyle. So continue with that, guys, and spread the word around. That's all.
And thank you for joining us today. We'll be back with you again next month with another Talk with the Doc session with Dr. Akil Taher. Bye for now.
Thank you.